Hey everybody, let's continue talking about shoulder pain. Today we're going to be talking about 4 different types of shoulder pain that you may be experiencing. Now, somebody made a comment in one of the posts that's like, there's a million things that could be wrong with the shoulder, and that is absolutely true. So what we're going to talk about today are some generalities, and unfortunately there's not a one-size-fits-all for your shoulder, and so we try to do the best we can based on what you tell us your symptoms are to help you figure out what's going on. So my piece of advice always is to consult with a physical therapist. A lot of us do free injury screens, so go in, talk about your shoulder pain, tell them what's going on, what makes it worse, what makes it better, and we can really then help start to narrow down some of the causes. So today in these 4 things that we're going to be talking about, maybe it'll help start guiding you on some options to look at. So the first thing are what we call radicular symptoms. So that might be a tingling, a numbness, any type of neurological or nerve-related pain. So this can come from a nerve being pinched in your neck. There is a big bundle of nerves that comes off of your neck and travels underneath your collarbone. That can get pinched. Any of the nerves along the actual shoulder and into your upper arm can be pinched as well. So those types of pains, tingling, numbness, sometimes an electrical shock symptom, those are more nerve related, and so a physical therapist can help guide you then to the right doctor to help address a nerve related pain. The next one is a trigger point pain. So this is very common in people that sit at a desk all day. Maybe you get this type of pain if you've been carrying something like your child on your shoulder, on your side, or carrying bags. I get it when I'm standing for a really long time and trying to hold a backpack. And so the symptoms I get when I get this is I have a very specific trigger point that's in the back of my right shoulder blade. It almost feels like a hot poker. So somebody just pressing in one spot and won't let up. Sometimes it feels better to rub it and massage it. We'll talk about some trigger point relief stuff in one of the next videos. But this is more in this upper trap area, scapular area, so around your shoulder blade. Or you may also feel a symptom that's sometimes related to this is what we'll call snapping scapula. And so this is where you kind of can roll your shoulder blade back and forth and you'll hear this like clicking or snapping. And so that sometimes is also related to a trigger point. Sorry, I have to consult my notes so I don't forget anything. The front of the shoulder can be a couple different things as well. So if you have pain that's right here, kind of at the very top of your shoulder, that can be your bicep tendon being pinched. And so what that feels like is pain here if you're reaching up or over, sometimes behind your back. It'll be a very sharp pain. And so we have to figure out why your bicep tendon is so irritated. It can also be a little more to the top and front of your shoulder, which may be a result of one of your rotator cuff muscles being pinched. Those pains will usually come on if you're reaching out to the side. You know, if you're sitting in the driver's seat and you reach across to the passenger side, you may feel that kind of like pinching or pulling. It almost takes your breath away because it's so sharp. What else? If you lay on that side too, it can be very painful. So sometimes that is a key indicator that the doctors look for, is if you have pain laying on that side or if you're laying on the opposite side and you have a hard time getting comfortable, because sometimes if that rotator cuff muscle isn't doing its job and holding everything in place, you'll feel this aching that starts to happen. And the last one is shoulder pain on the side. And this may start very simply like you're walking down the stairs, you fall, and so you go to grab the banister. And maybe it doesn't hurt initially, but over the next couple days it starts getting worse and worse and worse. And then you have trouble starting to lift your arm. You need to see a doctor right away for that. That may be a symptom called frozen shoulder or adhesive capsulitis. The problem with that is as the scar tissue starts to bound down on the actual shoulder joint, you start losing motion very rapidly. We don't know why this happens. There's some discussion that maybe it's from hormones. It's usually in women over the age of 45, between 45 to 65, and you just start losing motion really quickly. If that happens, there's some things that can be done to slow it, and sometimes there's nothing can be done, and then it takes about 18 months to heal. So that's called frozen shoulder. And again, we can talk a little bit more about that in one of the other videos. But those 4 types of pain are just some of the symptoms that you may be experiencing. So again, I would recommend following up with a physical therapist to help them you tell them what you're feeling, and that will help them help you figure out what to do. So our next video will be on some stretches to help with shoulder pain. Then we'll move into strengthening exercises that we love as physical therapists, and also some pain management options. So if you guys have any questions, please shoot me a message, and we'll continue the series as we go here. So thanks so much.